One. Hello? Hello back there? I know y'all are excited to be here. I'm excited to have you. Good evening. We're going to go into our work session tonight. I think that we have 3 presentations, and I'm going to turn, and I do want to make note our mayor is sitting in the audience. So I think he's going to be grading me or something. But I'm going to turn this over to our county manager, and it's in your hands, sir.
Thank you, Mayor Pro Tem. I appreciate that. We've got several things for you tonight. Tonight was meant to be a special session to hear some annual updates that you've requested specifically from the neighborhood leaders and also the Athens Homeless Coalition. We normally would have our benefits discussion in April, but there are reasons why we needed to bring it forth in March. And rather than lump it on to 4 that we had on Tuesday, I just appended it here, and I hope that's okay. But this is a very important big rock that you'll be asked to understand and consider in your budget deliberations that are going to be happening over the next 75 to 90 days. So we have our consultants here from EPIC as well as our HR folks. And I think you'll find this instrumental, and there's a recommendation in this on how we move forward with our benefits with regard to our employees. And I'm looking forward to hearing more from you.
Thank you, everybody. Great to join you again. My name is Stephen McKenzie. I'm a benefits consultant with Epic Brokers and Consultants. I've been working with the Athens-Clarke County HR team for a number of years. And today we're going to go through a few items, mainly related to the fiscal year 25 planning and some of the strategy considerations that we have for you all. On the agenda is the employee survey results. And it's important to start off the meeting with this topic, mainly because it affects some of our considerations and recommendations for the next year and so on. Regarding the mission statement and benefits program overview, this is something we've worked on with the managers as well as the HR team to develop a strategy and a thoughtful process to how we outline our benefits program and what are some of the key priorities as well as guiding principles of our program. Managing employee costs, this is a little bit of a result of the employee survey results, and we have some ideas on what we can do to help manage those costs for employees and their families for years to come. And then pooled health insurance strategies. We've had some discussions in similar meetings in the past about what it looks like or what would it look like to join a health insurance pool, or maybe even consider something like being fully insured. So we have a couple slides on that as well too. As you're aware, there was an employee survey that was done in the last year, and the results we've concentrated on in this presentation are mainly around the benefits program. First and foremost, one of the things that we noted was health insurance is second only to wages as a top priority for employees for investment by the government. 87% of your employees placed pay and benefits in their top 3 priorities on things that ACC Gov needs to improve upon. And then finally, 20% of employees agree the amount ACC Gov employees pay for healthcare is reasonable, which you could defer that 80% of those think maybe it's too high, right? And then finally, the importance of it. So on a scale from 0 to 100, with 100 being the most important, health insurance was rated 94.3. So clearly a critical component to your benefits plan, nearly as important as wages, and something that employees feel is perhaps too costly. So just keep those things in mind. With that under consideration, as well as some surveys that we've been conducting for many years now around the benefits program, what we've come up with as kind of 2 main goals and strategies for the next year and on is to maintain near median benchmark plan design. What that means is you have 3 plan designs that you offer today for your active employees. One of them is what you call a more rich POS or PPO type design. The 2 other high deductible health plans. You tend to offer a design that meets the wide array of needs of your employees. You offer what I call a richer design, a median design, and then a less rich design. So for those high, average, and low utilizers of the plan. So let's maintain that strategy going forward. And then let's achieve 75% employer cost share for healthcare. Right now, you are below that number, but we think if we can get to 75%, that maybe the bold bullet point up above will begin to change a little bit, and we'll see healthcare being more reasonable for the majority of your employees.
Well, and if I might.
Yeah.
One of the things we talked about is year after year, we come to you with some fairly complicated ideas about how to invariably absorb a percentage increase of health insurance over time, and you have a litany of questions, some of those that we're going to answer tonight. And so I think this is very important. If I leave you with nothing else, those 2 bullet points at the bottom, that is an effort, after talking with our consultants, 2 ways to be able to view and compare a health benefits plan is how much the employer share is, and then how relatively rich the plan design is. That is the deductibles and copays and all that. So what I wanted to do is challenge our staff and our consultants for us to come with two aspirational goals so that at least you could understand all of this through those 2 things. And so you're going to hear more about that, but this is really important and different from what you've seen in the past year. We're giving some things to shoot for. You can let us know whether that's sufficient or not. You can give us a different target. We can give you costs to get there, okay? So this is different from our conversation in the past. So I think this is very important, and I'm appreciative of it.
Thanks, sir.
Are you going to, in a later slide, address where we are right now in terms of that 75 that's
Yes.
coming down the road? Okay, good. Slide 9? Okay.
So keeping in mind the survey results, one of the things that we've worked on is coming up with a few guiding principles, annual strategies, and an overall mission statement, trying to drive towards a total benefits program that's really meeting your employee needs. So if I start at the bottom, we came up with these guiding principles after a few discussions with the managers and the HR team. This is the foundation of your benefits program. Number 1 was addressing the whole person. That's the mental, physical, emotional well-being of your employees and their families. Financial stability. So of course it's important to offer good benefits, but we have to keep in mind we have to be good stewards of the money that your plan incurs. Guided by employee survey results. So those survey results were pretty impactful on our strategy, and we want to continue to evaluate those on an annual basis and making sure that we're delivering on some of the items that your employees want. And then recruiting and retention, just making sure that we recruit talent, and benefits being a key part of that, and we retain talent and make those folks that are employees today aware of the benefits that you all have and what you're doing to improve those. So the first 2 pillars of annual strategies that we're looking at this year and for the next few years, we talked about in the previous slide. That's maintaining near median benchmark plan designs and achieving 75% employer cost share. A couple other ones that are important. Releasing total reward statements. This is a statement that provides your employees an overview of everything from medical, dental, vision, life insurance, everything that is provided to them, 401k, so they can understand the benefits that are offered and really what the government does pay for on their behalf. Engaging and educating employees in a new and more effective ways. Times have changed, of course. Everybody has a cell phone in their pocket. We want to utilize technology to the best of our ability to communicate everything from open enrollment to perhaps releasing total reward statements in a more technology-friendly manner. And then finally, continuing to evaluate cost management strategies. So just doing what we can to create financial stability in the plan, making sure that we're turning over every rock there is and looking for savings regardless of what your plan design or employee contribution strategy is. With those guiding principles and the annual strategies, we hope to build to that mission, which is to become an employer of choice. And that's what we want to ensure that we are for the residents and the surrounding folks in this area. To provide a little bit of an overview and a refresher, we have the current program overview and summary. These are all your main benefits and the providers associated with them. So medical, vision, and your tax advantage accounts, which are your HSA and FSA, are with Anthem Blue Cross Blue Shield. Your dental is with Cigna. Supplemental life insurance, disability, that's all with Unum. And then you have LifeWorks, which is an employee assistance program, no charge to the employee, and that's covered with the LifeWorks. Pet insurance is through Nationwide. And then finally, your retirement and financial planning is Corebridge Financial. So managing employee cost. We talked about the goal to get to 75% employer cost share. That was identified as the biggest issue that your employees have with health insurance that ACC Gov offers, was the cost to participate, the cost out of their paycheck to enroll in one of those plans. In 2023, that cost share was around 68%. The increases on employee contributions for 2023 varied by plan. For 2024, contributions were held, which is great news for your employees. Most employers do not hold contributions, given the inflationary aspects of healthcare, but you all did. This increased the employer cost share to near 71%. And then in looking at the next few years and where we kind of want to go to get to a 75% employer cost share, we're recommending that we hold contributions for the next 3 years to get there. You can see what that does over time. It eventually builds to 75%. Some unknowns in here are the trend associated with healthcare. You're a self-insured plan, so you're going to have some volatility from year to year. But eventually, after we think the next 3 or so years, you will get to a 75% employer cost share, which obviously would reduce that percentage that employees are paying out of pocket. And what does that look like from a dollars and cents basis? You have a question?
Real quick, that's the plan, and we know what that cost looks like this year. What we don't know is what the cost looks like in years 2 and 3. So both for your expectations or our employees, that's what we would like to do, but you have to see what the cost is at that time, what the other burning priorities are. But I think the main takeaway is we have a plan that we'd like to try and follow and communicate to people.
Thank you. And so our best estimate as to what this looks like over the next 3 years is broken out here. As you can see, the employee cost stays the same for the next few years. We have to project out what the total cost will be because that healthcare does go up year over year. So we've projected that out into 2027, and that's our best estimate at this point. You net out the employee cost from that total cost, and you get the ACC Gov cost, which is the employer cost. And then finally, the percentage cost share is just what the employer is paying as that total. And so at this point in time, with some assumptions on national trends and making no plan design changes to maintain that median benchmark plan design, we do think by 2027, there's a decent likelihood that we do achieve that 75% cost share, which again goes back to trying to make those contributions and the cost of participating in your plans more affordable for your folks. Any questions? All right.
Do you?
Oh, go ahead.
I haven't gotten through all the appendices here, but is there a breakdown on what this looks like for the average employee, just in terms of what they're paying?
Yeah, so your contributions today and what the percent is varies, of course, by plan and then by tier, whether someone's an employee, child dependent, and so on. So you're going to have, for instance, in your high deductible health plan, someone may only pay 10, 12, 15% of the total cost of it. However, in your POS plan, which is your more rich plan, they pay 34, 35%. So again, this is a little bit of an estimation art here when you're trying to assume what the enrollment will be in those. But if you hold those constant, those percentages that the employee pays will just obviously decrease as the plan cost goes up over the next few years. Mm-hmm.
Are those numbers based on having all the positions filled, or do we have a certain percentage vacancy factored into that?
So they assume current headcount. So your total cost there assumes the headcount as of today, and we project that forward. We could develop, essentially a per employee per month or per year metric that accounts for the fluctuations. We'd still probably arrive at the same cost share percentage. But yes, as you hire more people, for instance, your total cost would change.
What percentage vacancy do we have right now?
You're bringing up a great point, and we're having that discussion right now during budget around salaries. So you remember in the past we carried a lot of vacancies, and that I'm glad to report that that's changing. We're starting to fill back up, which is great, but it does cost more when you do that. And so we are searching for, I think what I've asked HR to do is to kind of do a trend analysis of how we've been filling up. They've already done that, but extrapolate it out to the end of next budget year to see what percentage we would be filled, and then use that number to help project what the salary cost and the benefits cost would be. So they're in the midst of that right now. It's a good question.
A question here on that cost share amount. When we talk about salaries and we're doing all of this, cost comparing to the market and other places, what are the numbers, the percentages on governments overall and county municipal governments?
Yeah. So it obviously varies, but I would say generally you see a 70-30 split. You do have some more local county governments that have a higher percentage than that. I think that's probably where we hear some of the feedback from employees on. And so just taking into account the whole market, the whole, even the private sector that you may compete against, as well as governments in general, and then some of the local, we think a 75% cost share is more than appropriate there. So you're going to have some that fall below you, but also I just know that for a fact that there's a few around you that are going to be higher than that as well.
Do we know what percentage of our employees are using our benefit package?
That's a good question. I don't know the opt-out rate, to be honest. I do know that you have very few non-utilizers in your plan. I want to say it's less than 10% of the people. So not 90% of the folks that are electing your health insurance are utilizing it, whether it's a doctor's visit or an intense surgery. I don't know it for sure, but you do have high utilization of it, yes.
So did that survey data break down do we have a sense of what types of plans people are on, and whether the dissatisfaction is equal across all those tiers of plans, or if it's especially true for people
Yeah.
on a certain plan?
So the survey does break it down. It'll typically have a statement of, how much enrollment do you have in a particular plan design, or do you offer one of these plan designs? It's definitely fair to say that most employers offer a PPO, POS design and a high deductible health plan. You offer one PPO and POS and two high deductibles. If I looked at your high deductibles in a silo and compared them to other high deductible benchmarks, one would be more rich and one would be less rich. And then your POS plan is very much in line with the benchmarks of other POS and PPO type plans. So I would say it's a fair statement. You offer designs like many other employers, governments included, and that it's a high deductible and a traditional plan. And then you have a plan design to meet the low, medium, and high utilizers, essentially. Does that help answer your question?
I think so, but I'm just curious if the survey data that we did of our employees, if we're measuring satisfaction. I mean,
your
understanding
specific
how we stack up against other communities is helpful, but in terms of what's got people who are currently working for us more or less happy, is there a difference across the plans?
I'm not sure if the survey drove down into that level of specificity. I just know the number one thing related to health insurance that was commented on was the cost to participate in it. But I can get back to you and see if there was anything related to individual designs.
And I don't mean to jump ahead of where you are in the presentation too much, but I think do you happen to know if slide 36 is the one that answers my question of average employee costs?
Let's see.
Like what they would pay?
Yes. So this is what I was mentioning earlier here. If you look at the conventional POS, that top chart there, I'm going to go to the middle of that section, which has total annual employee costs with your HRA credits, which the majority of your employees get. That cost share is 35 to 39%. Comparing that to a benchmark design, the PPO, POS design, you can see it's 14 to 26%. So in general, your employees pay more for the similar type of plan. And then going down to those other two charts, that looks at high deductible health plan benchmarks. You can see the select plan is a more rich high deductible health plan than benchmarks, but people pay more for it. Whereas the CHS value plan is a little bit less rich, but your employees are paying less than benchmarks. Does that help?
I think so. So this is comparing our current plan to what other communities would have, or our current plan to what you're proposing we do instead?
This compares your current plan to a data cut of similar organizations.
Similar organizations, okay. And so if we're moving forward with the proposal to get us up to that 75% benchmark, does that put us in line with this right column of benchmark plans?
You will fall very closely in line to that. I mean, obviously, it depends upon where enrollment lands, because it changes the weight of it, but that's kind of the goal.
Okay. So us ticking up a few percentage points can lead to employer contribution ticking down many percentage points is basically what I'm gathering here. Yeah. Okay.
Any others? All right. So we have been evaluating some other health insurance strategies. I know there's been a few questions on it in the past, and as of right now, these are non-recommended health insurance strategies, and I'll go through a couple of examples of those in just a minute. The first one here is health insurance pools. So one pool in quotes is ACCG. This allows employers to our county, Georgia counties and authorities to basically buy workers' compensation, health insurance, and other risk-related programs. The advantage of being in ACCG is you could be self-funded if you wanted, you could be fully insured, but there's some advantages when it comes to wellness-type programs and resources available. You have a very expansive wellness program today. You get wellness credits through Anthem, so you're achieving much of what would be available, if not more, already in your current environment. One important note related to ACCG is that in September of 23, the contract with Anthem Blue Cross of Georgia was terminated, or announced that it was going to be terminated. So there would no longer be the same network that you all have today through Anthem. That's going to change under, or that would change under ACCG. And then just to comment on it in totality, you've managed a pretty comprehensive benefits package for many, many years. You have the flexibility on carrier selection, plan design, network, cost management strategies, everything on the pharmacy side of things, very successfully, and you've done that independently without joining an association like ACCG. So at this point in time, it's our general sense that it's not something that would lead to advantageous pricing or network or carrier relationships. Another health insurance question or pool question was, can we essentially create a health insurance pool with other employers? The short of that is you could, but the issue is that with a true shared risk pool, shared resources and underwriting, you end up creating what's called a MIWA. It's an acronym, but basically when you do that, you create a MIWA, and with that comes significant regulations and restrictions that do not exist for ACC today. So you would open a new can of worms to say, if you went down that path. You'd also, as part of that, it would not necessarily align with your program strategy that you have and the cost management strategies that frankly have been pretty successful, like for instance, the pharmacy RFP that we recently did this past year. So I think when it comes to pooled options, you're in a good place right now to not go down that path, but it's something that we will continue to evaluate as questions come up.
I'm probably one of the few commissioners that probably disagree with you on that, with pooled resources. And I find it interesting that Anthem canceled their insurance with ACCG. The same thing could happen to ACC Gov. If, Anthem has gotten into a lot of different contracts with some large employers and others with small employers. And I guess with pooling, sometimes you have a little bit more buying power, a little bit more stability from that perspective when you stand alone. And I lived in both worlds. Mm-hmm. I've been in part of a self-insured, I've been a part of a pool. And of course, pool to me, again, it's one man's opinion, tends to offer better pricing for our employees, also give them opportunities and options. Yes, sir. So, and you guys are the experts. I'm not. Again, this is just one man's opinion, but I do know there can always be a possibility. We self-insured, and Anthem can say they can raise our rates real high or whatever. Then, if we don't meet those contracts, they can cancel. So that's just sort of my reason about having pooling with other organizations or other local governments. So.
Yes, sir. No, I understand that, and I think we continue to evaluate it. We have pretty much every year. At this point, I think you're of the size where you have the buying power, and Anthem has the investment, frankly, in your employees, their families, and the benefits you offer. So I think with all that being said, we feel like we're in a pretty good place right now, but I definitely appreciate your comments. Any other questions?
Do we, I'm going to ask this one, going back to that. Is there any, do we know why Anthem pulled out of ACCG?
Don't.
Okay.
Could have been a mutual decision. I don't know the answer for that.
Okay.
Certainly, we'll look into it, see what carrier partner they picked, but it would be it would be a true statement that ACCG would no longer have Anthem as their health insurance network, basically, or provider. Questions?
Anybody else?
One of the other items that we continue to evaluate is fully insured strategies. So right now, you're obviously self-funded. You essentially act as the insurance carrier. You pay Anthem to help you adjudicate the claims and manage the network, but you pay the claims of your employees and their dependents. What we've found is that there can be many disadvantages to being fully insured. As part of this due diligence process, we've gone through those and outlined a few of them below. One of them, and perhaps most importantly, is the lack of program flexibility. So when you're fully insured, the plan designs that you select are not the full discretion of you as the employer. They're rather largely dependent upon the health insurance carrier offerings, since they're a state-filed plan. Cost management strategies are limited. When you're fully insured, you buy their whole suite of products. So, for instance, pharmacy management, we looked at a pharmacy RFP last year. Significant savings to the plan. Had you selected another vendor that had savings and that vendor not be Anthem, you could not carve out that pharmacy strategy in a fully insured environment. You would have to stick with your fully insured carrier. The rebates associated with that, as you can see, are quite substantial. Those rebates today flow back into the plan to offset the cost for everybody. When you're fully insured, those rebates stick with the insurance company. And then finally, limited or no access to third-party point solutions. Again, the suite of products that you buy in a fully insured environment are what they are. You have to buy the carrier's products, so you don't have a ton of flexibility to go find a point solution or perhaps a local resource to plug and play and address a certain condition. You have an incredible wellness program today. Some of those wellness aspects may not be accessible or able to integrate with a fully insured product. Also, carrier margin, overhead, and profit. So the premium paid by Athens-Clarke County government would be dependent on the overall profitability of the health insurance carrier. If that health insurance carrier had a bad year, financially, there is a chance they increase your premium at a higher rate than what your claims justify. And then within that premium that they charge you, of course, is the insurance company's profit, overhead, and margin as well. You don't pay any of that today, since you're essentially acting as the insurance company yourself. And then just in terms of overall costs and how things trend, this is a general statement, but it's in any given year, it's probably 3 to 5% more expensive to be fully insured. And of course, you have less ability to manage that cost. So in year one, maybe it's a little bit less costly to be self-insured, but if you don't manage the cost, then that spread just grows greater and greater over time. And then also, too, in the fully insured medical space, the carriers, the organizations there are going to give you a 1-year rate guarantee to your rate. So maybe you have a carrier that gives you a really good rate for 1 year, but the next year they're going to come and try to make up any losses they had. So you can have that fluctuation, maybe not on a month-to-month basis, but on a year-to-year basis because of essentially them trying to get back any losses they may have had. Good.
I have one of these questions that it's taken me 4 years to figure out that I should even be asking it to understand. With this fully insured, but we're self-insured, right? Mm-hmm. Okay. So I think there's something that I haven't quite understood. So tell me if this comparison makes sense. We work with, what company do we work with? Who manages this all?
Anthem.
Anthem. Okay, so let's say I don't have Anthem, but let's say I have Anthem. I used to have Anthem, they switched. And I have Anthem, and I'm insured, And some years I don't use much, other years I use a lot more than I might have paid. But it goes forward, it's like, it's using a whole lot more money than I paid on those emergency years. As a county, is that analogous? Is it like, let's say, well, what did we say? We were something to putting in like 14 million, and then probably total it's 20 million there. Let's just say it was 20 million between employer and the individual, the workers, employees. Does that mean that we could have expenses that are 30, 25 million, because it's going into that Anthem pool, and they might come back, like the car insurance, now we're switching over to car insurance, and say, hey, you guys used a lot, so we're gonna up your fees a little. But we get paid, we're not limited to the amount of money that's put in there if we have crisis situations.
Correct.
So do you understand my simple question
Yeah,
here?
so in a fully insured environment, your cost as a government is fixed
Right.
in a given month-to-month basis, right? So if you did have a year where you spent 40 million in claims, but your premium was only 20, they're not going to charge you 20 more.
Right,
But when your renewal comes, they're going to try to make back their losses.
yeah, and they also are looking at the losses of the whole industry as well. So
Yep.
let's say we have some, I don't want to think of some bad thing that happens, but we have a lot of people, there's some hurricane comes through
Yeah.
and we have a lot of stuff. So we have a lot of expenses. Okay, that helps me understand something I've missed for the last
COVID was a
3
great
years.
example of that. We saw increased health insurance expenditures across the country. And so in the fully insured environment, it was very typical to see double-digit increases for the last few years because of the overall utilization just increased. So everybody kind of shared in that increase.
So it's like a huge family.
Yep, pretty much.
It's the ACC family plan
Yeah.
with Anthem. Okay.
Any other questions? All right. So the self-insured advantages, as you can see, they're kind of just the opposite of what the fully insured disadvantages are. So obviously you avoid that carrier margin, the overhead and profit. You're not paying that today. You have the program flexibility. When we decide on a plan design change to a deductible or copay or out-of-pocket maximum, completely up to your discretion. You don't have to ask for approval of that. Those aren't state-filed plans. You get to make those decisions. Cost management strategies, just like last year when we went out and did the pharmacy RFP, which reaped a good bit of savings, you had complete discretion to do that. You don't have that discretion under a fully insured environment. Stop loss coverage, which basically allows you to mitigate very large claims and the cost of large claims. Under a fully insured environment, you pay the insurance company a fixed amount, and they manage that stop loss exposure. In a self-insured environment, you're able to find the best stop loss coverage carrier for those specific large claims in any given year.
Steve, you might want to make sure she understands stop. Do you understand what stop loss, how that works?
Yeah, you can explain it.
Sure.
I think I do, but I was
Yeah.
actually thinking of my next question, not paying attention to you.
So real quickly, stop loss, so you're self-insured today. The government's paying the claims for everybody, but you're not, in theory, completely self-insured. What you've done is you've purchased stop loss, and this stop loss is through Anthem, but in self-insurance you could buy it through any stop loss carrier. You buy stop loss to protect you against catastrophic claimants.
Right,
So if you had a $3 million claimant, you're not actually paying $3 million. You pay a premium to a company that caps your exposure on any given claimant at $200,000, for instance. And that's stop loss coverage. So you have flexibility to go to any company you want to source that in a self-insured environment, which is something that we do through RFPs quite frequently for you all, is to make sure you have the most competitive price for that little piece of fully insured coverage within your self-insured program. Does that help?
yeah, it helps, but then one other thing, since I'm really getting into this insurance thing right now. So, having worked for the state myself over at our technical college here, there was no one locally who had to think about like, we just got the plans, right? They were just handed to us. So on our local level, though, we're looking at those plans ourselves. Who's doing that? Are we contracting out, or is someone in HR doing that? Is that what you're doing?
It's a combination of HR managers, myself, resources throughout the industry, surveys and things like that. We're constantly looking at the competitiveness of your plans, the cost of them, and as well as working with your partners. You pay, for instance, Anthem to administer your plan. We work with them to get their thoughts on input, on designs, management strategies, and things like that.
And
as well.
where does that get paid for from? Does that get paid for from the what?
The health insurance fund.
From the health insurance? Okay.
Yep.
The health insurance fund pays for a number of things, not just premiums, but also the administration of the plan.
Okay.
And we mentioned this a couple different ways, but obviously under a self-insured environment, you're only paying the claims incurred by your plan's population, whereas fully insured, like we said earlier, if there was a bad year for the insurance company, in theory, your price could go up due to someone else's experience. And then a bigger and bigger ticket item in these days environment with the cost of medications is pharmacy rebates, which are paid on brand drugs. This is projected to be about $2.4 million in fiscal year 25. So that was a function. The improvement to those numbers was a function of the pharmacy RFP that we just recently did for you all. So in terms of next steps and decision points, we try to boil it down, as Blaine mentioned, to just a couple key items. So we want to hold contributions and have that continued push towards 75% employer cost share. The cost to do that in fiscal year 2025 is 6.1% over today's number, which is about a $788,000 increase. And then obviously the other part of that is maintaining plan designs. We want to continue to have the plan designs that are offered today and not make any changes to those in future years as well. Any questions related to those slides?
Commissioner Hall?
Yeah, I just want to understand clearly the holding employee costs, which I would love to see us do again. If I go back to slide 10, that total for employee cost goes from 5.4 to 5.6 million.
Mm-hmm.
So is that just reflecting an increase in the number of employees we have? Okay, that's not reflecting them paying
Right.
any more.
Right.
Okay,
It's
so
just
we are actually holding the same amount per
Yep.
employee.
Yep.
Okay. And then I guess my other question while we're here is, we have Cigna for dental, and if I'm understanding correctly, this is all based on Anthem and the healthcare, but where does Cigna and the dental coverage play into all this? I mean, are we looking at that
It's a
being
separate.
approached the same way in terms of employee
So
costs being held?
dental is, so you do have solid benchmark designs and contributions with those. That's also a fully insured product. Obviously, there's a lot less volatility in dental. It's a lot less costly than some of these numbers on the board here. So it's very common for employers of all sizes to fully insure that. That was out for RFP, I want to say, 2 years ago. So we did a competitive bid on that, and I got a multi-year guarantee as part of that process.
Okay. So no decision needs to be made right now about dental, and that's going to continue to coast as it has been for the past couple of years?
Yep.
Okay. Thanks.
Well, at currently, as y'all know, next Tuesday is Big Rocks. We're putting the finishing touches on the draft budget that will be presented to you next Tuesday. I just want to go back to where you started, and that we're paying close attention to the employee survey and what we heard from the employees. And at least in my current version of the budget, the $700,000+ that you saw in the recommendation is accounted for in the budget.
I do have another, if I go back to the title slide, you don't have to, but you can. It says 2025 Employee Benefits Strategy and Renewal Discussion. And so the bigger picture here isn't just the health insurance, but it's the benefit strategy and renewal discussion. And I had spoken with Manager Williams a little bit earlier today about any movement we've made with parental leave. And I don't know if that's in your purview or the manager's.
Well, there's nothing in this presentation about parental leave, but Commissioner Myers, maybe share a little bit more about what you're thinking, and if we can't respond to it tonight, we'll respond to it and follow up.
Oh, well, I guess when we talked about it, was sort of, paid leave for when people have babies, so that they can so they can stay and take care of their babies. And I know that we've talked about this before with elders as well, but and that's fine with me, being more elderly myself, but, I'm just thinking about that as a benefit, and something to support our employees.
Would it be helpful to get some statistics on what other employers are doing in that space, sort of thing? Could we have
Yes.
some of that we can provide?
And then, Bonnie, I can work with staff about, what that might look like or what a cost might be around that, in case
Yeah.
you want to talk about it further.
Yeah, because I think, as a grandmother now with children who are in their 30s with young children, I know that is a big, gigantic factor in terms of stress for young parents, mother and father, being able to stick with Athens-Clarke County, have a little time to that bonding with child. We want to respect those things, and that's a way to support our employees.
Commissioner Culpepper?
Is that part of the health insurance or part of the PTO package? I mean,
That really is more of a leave type thing, but it is a benefit, so.
Yeah, I was looking at benefit.
This is
the
mostly about
Broadway.
health insurance, but this is an appropriate time to
Yeah.
talk about other benefits you might be interested in too.
Commissioner Hall?
So I think this is my last question on this topic today. It's a lot to try to digest, but I'm going back to, I don't know if you need to pull it up, but slide 4, 20% of employees think that what they pay for healthcare is reasonable. I'm assuming, Manager Williams, that your proposed budget is going to include also an increase in salary to try to.
Yes, and that's where we are now. And and I won't go over what we'll talk about Tuesday, but we're having to make up for some use of one-time money last year with our new revenues. And that's why we would always say, try and pay for one-time initiatives. Don't pay for ongoing initiatives with one-time money. So we're making up some ground. I'm trying to balance the budget. But yes, I hope to have a fairly substantive increase to propose to you.
Okay. So yeah, I guess I'm just trying to make sense of how well do we think we're going to address the fact that 80% of our staff is dissatisfied if we're just holding their cost at the same? I'm assuming that we think the raises will help offset that dissatisfaction somewhat, but I mean, how much are these costs just so high anyway that maybe that raise doesn't make a big difference?
Well, we'd have to look at where we end up with the final number. But obviously, when we look at a total compensation and benefits package, you could not do that for health insurance and add it to the salary line item, but it's still, inuring to the employee's benefit either way.
Sure, yeah, no, I'm definitely not proposing not holding it. I guess I'm wondering, does it make sense for us to consider paying in more to try to pay down the contribution? Like, is that a consideration that's been put forward in all this?
Well, and so that that is certainly I think a constructive suggestion. It's just a budget is really a constellation of priorities. So I'm battling pay increases. When I say battling, I'm trying to solve for.
Sure.
Infrastructure, life cycle costs. There's a lot of new initiatives that are being proposed. There's new positions. There's funds that we just have to support current services with to make sure that folks are accustomed to that. So it would come down to priorities for y'all. This is what we're putting forth, and if you need any additional information when we go through our various budget work sessions, we're glad to provide it.
Thanks. Well, I guess just a thought I'll leave here is that, my understanding is that some of the more entry-level employees or the lower salaried employees are the ones who are having greater dissatisfaction with this because the cost of health insurance is just kind of unaffordable based on what they make, even if we are paying maybe a competitive salary for the market or something. And so I am wondering if paying down the healthcare contribution by percent might have a greater impact for those like mid and lower level tiers of employers where, their percent increase in their salary might not offset the same as it would for some of the higher paid employees. Am I making sense with that?
Sure.
So I guess with that in mind, it might be helpful to just get like a cost figure, if not part of Big Rocks, because that's a quick turnaround, then at some point before we're talking about the budget on what it would look like to pay into reducing
I think the way that we did that last time, a few years ago, was we took the lowest paid employee and assumed that they were on the most expensive health insurance plan with full family to see if there was any. So we can certainly run that computation.
Anybody else? Okay, thank you.
Thank you. Thank you for your time. I appreciate it.
Thank you.
Thank
Thanks.
you.
Okay. Next on the agenda is the neighborhood leaders.
It won't be me presenting, I'm just setting up the computer.
With Terrace Thomas and,
She stepped out for a second, but she'll be right back.
My colleague.
Here she is. How do I make it go?
So it's a PDF.
Yes.
Okay. So.
you were in charge. That'd be fine, but you gotta turn them back in. That's what Jamie said.
Like, he has a bigger responsibility.
No, don't put those-
Securing our board than we do, so. He just had a bill in his pocket a month ago, and he failed it. That's what I was gonna say. I'm like, yeah, like, come on, man. Quit playing politics. I thought that thing was in that real large.
Oh, maybe not all the way. There we go.
Thursdays are my busiest days.
I believe you can go to.
Did you attend? Shady Brook.
Oh, yeah. It was good.
That's all you.
The neighbors are happy.
The bands.
I'll talk to you.
To go back, is this?
I think.
Okay.
Good evening. My name's Tim Johnson. I'm Executive Director of Family Connection Communities and Schools of Athens. I'm wearing a mask because I've had a little bug the last few days, and I'm doing my best not to spread it. But I just wanted to say again, thank you to the commissioners and mayor and your staff for the support you've given, both in really establishing the Neighborhood Leaders Program as a model that other communities are now looking at, and it's really making a difference in our community. And we have fantastic neighborhood leaders, and we have a remarkable program director who recently was selected by the president of the university for the President's Award for her community service and engagement. And so I'm going to allow or request that Terrace make our presentation tonight, and we'll both be available for questions. Thank you.
Good evening, everyone. Again, this is the Neighborhood Leaders presentation before Athens-Clarke County Mayor and Commission work session. The purpose of this presentation, of course, is to provide an overview of our work, to share our successes for fiscal year 2024, and to share our improvements or suggestions for improvements for fiscal year 2025, and offer an opportunity for questions. As Tim has stated, we are indeed grateful to Mayor and Commission and the staff for your continued support for our initiative and the ongoing partnership. Overview of our work. As we state often, you probably hear it, we definitely use it. It's part of our jargon. The neighborhood leaders are indeed of the community, in the community, and with the community. Thankful for the partnership again, because this partnership utilizes our neighborhood leaders from Family Connection Communities and Schools to support community engagement and navigation for Mayor and Commission, the initiatives that are there to address poverty, social disparity, wealth inequality, and in Athens-Clarke County, and to support implementation of the strategic plan for ACC Gov. We're grateful because neighborhood leaders do address 17 of the initiatives in the plan. Neighborhood leaders are indeed trusted members of our community, providing needs assessment, service navigation to residents living in poverty, and we do so using the Bridges Out of Poverty model, and that model looks at economic class. Neighborhood leaders are themselves success stories. I state oftentimes they are VIPs. They're very important people to our community. But due to their own life experiences, neighborhood leaders identify with the residents that they serve. I find that to be their superpower. Fiscal year 24 successes. For the fiscal year 2024, we were able to define prioritized areas of focus, and those areas are listed here: food insecurity, housing access, physical mental health, employment, and we added civic engagement. As it relates to food insecurity, we envision a community where every resident has affordable, accessible, healthy food. And in that, we pre-screened 14,035 potential SNAP applicants. We re-enrolled 800 SNAP eligible applicants, distributed fresh foods to over 2,240 households, and participated in 42 community-wide meetings, trainings, activities focused on food insecurity. Those are also our tiered events. Housing access, we do envision a community where every resident has safe, affordable residence. And in that, we assisted 194 of our residents with the education, referral, security, legal, and other information related to housing. And of those residents, we assisted 100% of those assisted who requested assistance with applications. Public housing and Section 8 programs were indeed assisted. That's what I'm stating. 100% of those who requested assistance, we provided them with assistance. We also provided referrals to shelter and other homeless services to 100% of those residents who requested assistance, and we hosted and participated in. By the end of our fiscal year, we will have hosted 4 community-wide meetings relative to housing access. Physical mental health, we envision a community where every resident receives appropriate preventative and intervention services. And in that, we provided health and healthcare information to 3,500 residents, provided screening and assistance in healthcare insurance, WIC, other benefits, and enrollment to 100% of those residents who requested such assistance. We helped residents find healthcare services and providers, with at least 25% of them having a provider. Hosted 19 community-wide meetings or tiered event trainings, discussions, and strategic planning activities focused on physical and mental health. Civic engagement, we do envision a community where every resident is educated of the importance of civic activity and voter registration. We increased the number of eligible citizens who registered to vote and voted in elections. We contacted and communicated with 395 residents about voting, and 89 of those who were 89 of the 395 residents who were contacted, they were indeed registered to vote. We identified and reported 36 zone needs to ACC government and actively engaged in Family Connection Communities and Schools strategic action teams, Envision Athens strategy groups, the Homeless Coalition, and other planning initiatives. Our outputs, as stated there, 489 for housing. We assisted 18,457 for food insecurity, and that's SNAP, as well as distribution of weekly meals, food access, health services, physical, mental, vision, and dental. As stated there, 4,256 employment, unemployment, job opportunities, and this is, of course, our community information, referrals, and resources. Other financial assistance, that category, 1,471, and material goods, which are just needs, which would include NAIR goods, many times at the request of residents, what we find based on the zone needs. We purchased through our NAIR partnership, also Athens Diaper Bank, and then other partnerships. We assisted 97 residents, 717, and in that, we're really happy to state that we provided diapers to 2,191 children in Athens. This is just a screenshot here of the dashboard for July to 2023, and it's what it is a picture of the data, the case data that neighborhood leaders enter weekly. Each neighborhood leader enters 8 case notes based on their canvassing, their engagement, etc. So our outcomes, again, this is individual and household case management. Of the 489 that we assisted with housing, 64 received housing. Food, 18,457 that we assisted. 4,643 of those residents received SNAP benefits and or food from the Mount Olive Partnership. Unemployment, we assisted 4,236, and of those who were assisted, 122 received employment. Unemployment benefits, we assisted 20, and of those, as you see, there are 2 received benefits. Healthcare stated 154 were assisted, 71 received benefits. Those healthcare benefits. Childcare, 146. And then 36 received, and then the other public benefits, there are 311 of the 3,821 received benefits. Our economic impact, we've secured over $8.9 million a year estimated in SNAP dollars into our local economy, increased Medicaid, Peach Care enrollment, the WIC caps, earned income tax credit, that's an impact. And then again, we distributed over $1 million a year in food and donated goods to residents. Secondly, we improved data collection, as we stated, and we're really grateful for ACC government and HCD. They've updated the neighborhood leader online tool and the dashboard to incorporate our individual case management, tracking, community outreach, and the other indicator outcomes. We do appreciate you guys. We also, as it relates to data collection, we do plan to do zone resident satisfaction surveys by the end of this fiscal year. Our goal is to do so to be able to gauge the level of satisfaction with and in those areas of improvement for the individual neighborhood leaders and our program as a whole. And we're going to do that in June, by June 2024. Specialized training, our neighborhood leaders will start online community health worker competency training to include the following core competencies, and we will do so here this month, March 2024. That core competency training, as we stated, we thought we needed, and we do agree that we will engage in, and that's communication skills, interpersonal relationship building skills, as stated, service coordination and navigation, capacity building, advocacy, education facilitation, and individual and community assessment, outreach, professional skills and conduct, evaluation, research, basic knowledge of the social determinants of health, as well as basic knowledge of public health principles. That's the specialized training our neighborhood leaders will engage in. As it relates to our personal and professional development this past year, it's just a list of the various areas of training, information that we've received, education, and that's Bridges Out of Poverty, Restorative Circles, the Nonviolent Communication, Georgia Gateway System, Department of Public Health, Information Security, DPH's Customer Service, Civil Rights, and HIPAA, Suicide Prevention, Financial Wellness, Mental Health Awareness, Community Resilient Model, Financial Wellness, Narcan training, Circle of Security Parenting, Children First, Child Safety, Justice, Equity, Diversion, and Inclusion. We partnered and was appreciative of this opportunity with Athens Area Chamber of Commerce, their Workforce Development Strategic Planning, Athens Technical College Career Plus degree program, Lead Athens annual participation. We have neighborhood leaders who participate, board leadership, and then employee retention. We expanded our communications. As stated, neighborhood leaders invited commissioners to attend our neighborhood leader meetings and canvas opportunities via email monthly. And thankful Commissioners Dexter Fisher and Tiffany Taylor did attend the February 19th neighborhood leader meeting. Various neighborhood leaders communicate, of course, with the commissioners, but we're grateful that we've had neighborhood leaders to meet with Commissioners Houle, Myers, Thornton, and most, if not all others. And we, of course, we're here to present. We're presenting at the annual work session between January and March, which is today, and then, of course, our written quarterly reports. Funding, Athens, as it relates to 2024, we do get funding, unified government, and it's listed there, $1,102,661. The Georgia Department of Health, which is our DFACS partnership, that SNAP Outreach partnership, $158,634. Fundraising events and donations, estimated $40,000, and then our in-kind donations, which is $1,100,000 there, and that's from local churches. Again, our partnerships with NAIR, Athens Diaper Bank, and others, and that, of course, would be through the food boxes, the diapers, just the supplies, and other. And our projected requests, of course, our fiscal year 2025. Due to the cost of living increases in salaries, benefits commensurate with that of ACC Gov, inflation adjustment for other expenses, and then an addition of an assistant to the program director. So our improvements for fiscal year 2025. In the fiscal year 2025, we will continue to work on key aspects as defined in our fiscal year 24 contract, including areas of focus, the training, and then, of course, the resident satisfaction survey. Our areas of focus, just stating poverty is indeed complex, and individuals and families face a myriad of interrelated issues and challenges, and as we know, those challenges are personal as well as systemic. So we will focus on insecurity, and our hopes are, well, we're stating we will pre-screen 15,000 potential SNAP applicants, and we will re-enroll 1,000 SNAP eligible applicants. We will distribute fresh foods to 4,000 households and host and participate in 4 countywide meetings, trainings, activities, tiered events as it relates to food insecurity. Housing access, our improvement, our goal for this next year is to assist 1,000 residents with education referral, security, legal, and other information related to housing. And of those who need assistance and reach out to us, we will assist 100% of those. We will also provide referrals to 100% of those who request such assistance, and participate and host 4 community-wide meetings, trainings, discussions, strategic planning activities that focus on housing insecurity. Physical mental health. We will provide health and healthcare information to 6,500 residents, provide screening and assistance to health insurance, WIC, other benefits, enrollment to 100% of those who request such assistance, and we will help residents find healthcare services and providers with at least 25% of them having a provider. And we will also host 4 or participate in 4 community-wide meetings, tiered events, training, discussions, and strategic planning activities that focus on physical and mental health. Employment. We will provide one-on-one employment assistance and referrals to 500 residents. We will assist 3,000 individuals with job opportunity resources. 125 residents that we would assist, we are stating they will find employment. Participate in 4 community-wide meetings, trainings, discussions, strategic action, planning meetings that focus on employment. And civic engagement. We, as stated earlier, we do envision a community where every resident is indeed educated on the importance of voter registration and civic responsibility. We will increase the number of eligible citizens who register to vote and who vote in elections. We will contact and communicate with 500 residents about voting, and 125 of those that we contact will register to vote. And as it relates to zone needs and that level of communication, we will identify and report 100 of those zone needs to ACC government. Any questions?
Commissioners? I'm the Carol.
I'll come up with someone.
I know. I'm gonna call
what do
you
you-
before you even raise your hand.
Well, actually, I was reaching out to one of my neighborhood leaders to meet up with them, so,
Okay.
but what are you seeing any changes and trends in the community or in the neighborhood leaders? Are there challenges, issues that have evolved and become more widespread, more risen to the top? Just curious what you're seeing out there.
I would think it would be the housing situation because of the severe limitations. And there's a great need. Just yesterday, I got 3 text messages from someone needing food. I let them know what day the neighborhood leader will be delivering the food, and they was like, wow, I needed it today. And so the needs are there, but they're pretty much the same, but housing for certain.
Commissioners, any more questions?
Come on, questions.
Commissioner Hall?
Sorry I didn't make the last group meeting. I was unable to do it, but I appreciate that y'all
We
have
will
been
be
keeping us looped in. and,
We will be
Y'all are doing
extending
great work.
invitation.
Me
Yeah.
too.
Thanks to the colleagues who did make it. I am curious if you have any insights that you want to share, or if anyone in the room wants to share, about how the work you're all doing can lead to what I understood kind of the vision of this to be from the get, which is to help facilitate neighborhoods themselves being a bit more organized. It still seems like a lot of this is benchmarked around kind of direct service provision, which is great work, and I know that that's part of the trust building and the relationship building that's necessary. But if we seek for this program to kind of lead to that, neighborhood self-organizing sort of empowerment model, do you have any thoughts on how this program can move in that direction further?
Well, in order to do that, of course, that initial relationship has to be established, and then it's the consistent work with the resident who lives in the zone, building relationships, not just with that one resident, but then others. And so it is our goal, and we do have a few residents, a couple in some of the zones where you see the empowerment. A couple of our neighborhood leaders, I would venture to state that they have neighborhood leader assistants, and so they're from the zone, or residents from our community who work very closely with them in doing the work. And so that's an area of improvement, but our goal is indeed that. But we find, and I state this all the time, but we find that because of the needs, it's hard to empower when there's always a request.
Yeah, heard.
So our goal is that, and we do as often as we can based on that relationship that's built, and our neighborhood leaders do a phenomenal job with that.
So I thought you might mention the sort of informal neighborhood leader assistance. And I'm wondering, is there kind of a plan for this to evolve toward a structure where each neighborhood leader is more in a coordinator role and is trying to build up a certain number of neighborhood assistants kind of things?
I love that idea. I love that idea. Of course, what the request is an assistant to the program, just to help us do more, build it out. But I'm sure the neighborhood leader, again, they have that same desire, and many of them do have informal assistants that they're working with already. Thank you for that.
Commissioner
The only
Fisher?
thing I would add
Oh,
is
excuse
that
me.
the neighborhood leaders have frequently gotten residents to attend your meetings and other public meetings to give their input, whether it's about housing or other topics.
Commissioner Fisher?
Yeah, I just want to add to Commissioner Hull's question. I do know, at least in District 5, with our residents over in the Rolling Ridge area, for the last several years, that community has pretty much put on Juneteenth. Also, they have been involved in the process for how to get those funds. So I think it's a learning process for them, what they've been doing. Whether or not they'll continue to do it. Well, I think what's happening is Juneteenth has outgrown that area. and because of the good work that those residents did, to get that going and to recognize that particular celebration and holiday, I think it's not only contribute to our neighborhood leaders, but to the residents that live over there. So that's just one example. And again, and I'm just, pointing out what we do in District 5. So I do think that's a start to Commissioner Hull's
And many of
One
the
is
tiered
question.
events, thank you, Commissioner Bishop, but many of the tiered events, there's a resident, a couple of, who are assisting with communicating that we're having it, passing flyers out themselves and communicating, and then in place to assist the neighborhood leaders. So there are definitely opportunities for leadership.
One other thing, and again, I don't know what other commissioners do, but I do, I'd gone into, to Rolling Ridge area and visit with that community and stuff. And I think for me, it's good to know what their thoughts are and what's going on over there and communicate that, they can reach out to me. And I hope some of my colleagues would do that. And they may be doing that, again, I'm just speaking for District 5, but I just think it's important that as commissioners that we get out in these particular areas where, people may feel maybe somewhat threatened or afraid to go to, but you need to go and see what's going on, see what's happening. So.
Okay, Commissioner Myers?
Yeah, I remember last year that there are 2 positions that were, or if I remember correctly, that were sort of hired or state funds to get this increase of SNAP benefits, right? Mm-hmm. So I'm just wondering, have we seen any changes in like an increase, because there's so many people who are not getting that benefit who should be getting it. So have we seen any changes in the number of people who are eligible, who are getting it?
Absolutely. That's what we stated in the outcome slide. Absolutely. Our neighborhood leaders are doing a phenomenal job with the screening as well as SNAP enrollment. Yeah, we're definitely seeing an increase.
The estimated dollar value in the last year was $8.9 million in additional SNAP benefits from neighborhood leaders enrolling.
And I remember that was up there, but are there people who are not, what are the barriers to all the people who are applied don't get through the process, I would assume from those numbers. What are the barriers that are keeping people from, anyone?
Income limit.
Wait, slow down. I know, I like that information, but what are they?
Income limit, household size, not having telephones, social security.
Not having documentation.
Not having documentation, so very. Yep.
No address, so it's.
The gaps that are happening with defects, the communication, the problems with communication.
Yeah, anyway, good to know.
And our neighborhood leaders end up saying, well, I'll be the person that they can contact, so that's a level of empowerment too, that they help try bridge in that gap too, to make sure that the appointments are not missed and that the communication is clear and that the communication is vetted to the resident such that they are able to get the benefit.
Commissioner Hall?
I just have one other question, and it feels like this is as good a time as any to ask it because of the folks who are coming up after you. Could you clarify what the relationship is, kind of organizationally, between the Neighborhood Leaders Program and the Homeless Coalition? And I ask this because, all the neighborhood leaders that I've met with that are in District 6 area are working with unhoused folks a lot, or folks who are in housing precarity a lot. It seems like that actually takes up maybe a lot of their time. And so I'm just kind of curious what that dynamic is between that organization and the neighborhood leaders. I love that our neighborhood leaders are treating residents, including those who don't have or are barely holding on to housing, as part of the neighborhoods. But I'm just curious.
The relationship are that neighborhood leaders attend those meetings. Mm-hmm. They're vetting, they're sharing information, providing really solid feedback, and then I guess sharing. If there is an event or something coming up, they're communicating that with the resident. So that's the relationship, is a very close one, in that they're communicating what's needed to the Homeless Coalition and then working with them. So it's a really close relationship. In fact, it's one of our areas. We have a housing connector group, 4 of our neighborhood leaders. That's their strategic focus. And those neighborhood leaders work very closely with the Homeless Coalition.
And we are an organizational member of the Homeless Coalition.
Anybody else? Well, then I get the last word. This is so much headed in the right direction.
Thank you.
I think if there was anybody that had questions and criticism and concern, it was me.
Thank you.
And I appreciate that you took those concerns in a positive way and not in a way that, you know, I was trying to shut you down. I do think that one thing you didn't mention, which is a plus, and I just know because I know people, one of the things I suggested early on was that this should be a stepping stone for neighborhood leaders. And some of your neighborhood leaders have gone on to become, I think I read about Tanisha the other day.
Yes.
With prehistoric.
She's working with Historic Athens.
Historic Athens. Broderick is with EJC.
We shared
as a
about
director.
Broderick last year. He's now executive director of a local nonprofit.
All the training that you're giving will cost a lot of money if you had to go to college or it would cost a lot of money. So I do think that this has come full circle to what it should look like. I think Tim mentioned other communities that are looking at models like that. If they are, you need to include those in your reports too. We would be interested to see who is trying to peak our stuff.
Columbus, Georgia. Columbus, Georgia. I can tell you that now. Columbus, Georgia.
Yeah, I'm more than pleased in the direction. I know there's still a lot of stuff that needs to be unpacked, but I think you got a good team.
Yes.
I heard their voices back there.
VIPs in my book. They are
And,
VIPs.
yeah, they are VIPs. And I hope that you would jump on board with the upcoming information on the land use maps.
Okay.
I hope that is part of something that you could do. I think it's until April.
Okay.
But get involved with that. We need to hear from folk that normally don't speak about how we use our properties.
Okay.
Thank you for everything.
And,
Thank you, guys.
and Commissioner, I do want to say, we appreciate constructive criticism always. And one thing that we didn't mention is that you're encouraging us to help neighborhood leaders learn how to grant write, some of them. One of our neighborhood leaders wrote a grant that came for $10,000 to do restorative circles in East Athens. So.
Thank you. That's what it's all
They
about.
sure did. 10,000.
Tanisha, I'm glad she's moving on. Has someone taken her position yet?
Well, we will have.
Not out here in the audience yet.
Yes, they are in the audience. We've got neighborhood leaders who would transfer to that zone, and then their zone will be, that position will be open, so.
Okay,
we'll be
well,
hiring.
whoever you are, send me an email.
Thank you, guys, again.
Thank you.
Thank you.
I'm only kidding. I already knew what I was going to say after you. Yeah. I didn't do that. Ms. Jean, how does the ticket work for the? Pick it up and turn it into, okay.
Gene, they put it in the parking deck thing?
You know I love you. You know I like that.
Thank you.
Okay.
Okay. We're going to go with our, why are you pointing at me? Oh, okay. We are with our last presentation. We'll save the best for last, or?
Maybe so.
Maybe
We'll
so.
see.
Okay. It's all on you, Miss Sally.
All right, thank you. Good evening, everybody. My name is Sally Kimmel-Shepard. I'm here because I'm the Executive Director of Envision Athens. I have the honor to serve as Board Chair for the Athens Homeless Coalition. So the purpose of my presentation with you all tonight is to review the Homeless Coalition role in the continuum of care, report on activities since you all approved the strategic plan on October 3rd, and then you all gave a commission-defined option approved on January the 2nd that included a scope of work for the Homeless Coalition agreement. And then also to let you all know what's next, what's coming down the pipe for the Homeless Coalition. I think it's good for us to revisit again the difference between the Homeless Coalition and the continuum of care. The question was asked, how does neighborhood leaders interact with the Homeless Coalition? There's a difference between the two right now. The Homeless Coalition is a nonprofit that pretty much is a board of directors who are pushing forward the plan that you all gave us to move forward the Homeless Coalition and to receive ARPA funding. The continuum of care is a group of service providers who their daily work is to interact with individuals experiencing homelessness. So the neighborhood leaders are part of the continuum of care. They do not serve on the board of directors for the Homeless Coalition. In fact, we don't really have a whole lot of interaction except for my part and some other folks' parts as they interact with the continuum of care. So we get information from them, but right now the Homeless Coalition is separate from the continuum of care. Used to be together, now we're separate, but we communicate greatly and we will work together forever, as long as we're around, for sure. Does all that make sense? Okay. So we've got this ARPA funding agreement. You all put together an agreement, an intention for us to move forward, really balanced off of the strategic plan to prevent and reduce homelessness in Athens. There was an award for a little over $1 million for us to move forward with this plan. And so some of the things that you all wanted us to do was report back to you in 180 days. That's why I'm here tonight. And then also the strategic plan said specifically for us to move forward on hiring staff for the coalition, for us specifically to engage folks with lived experience, and that means persons who have experienced homelessness at some point in their life, whatever that means to them. And then also coordinated entry improvement. Coordinated entry means for us all to have shared information about persons who are using homeless services or designate themselves as homeless here in Athens. And so that way we can get a better picture about what is actually going on with homelessness here in Athens. We have something now, but it's sparsely used. Like hospitals are not involved, school systems aren't involved, law enforcement isn't involved. Pretty much service providers who receive federal grant funding are mostly involved. And so I think that was an amazing idea to move forward with a better coordinated entry program. And so I'll tell you how we're moving forward on that. And then finally, a homeless support fund. So in December 2024, when through my work with Envision Athens, I heard that this was going to be coming down the pipes. I had conversation with folks who serve on at that time, the Athens Homeless Coalition. That was also the continuum of care. It gets a little confusing, so holler at me if you need me to explain it to you again. But folks who served on the executive board for the Homeless Coalition, that was also the continuum of care, and I got together and we had a robust application process to get together a board of directors for what is now the Athens Homeless Coalition. We got to choose 13 board members. 4 of those persons were persons with lived experience. We made the decision not to include anyone on the board who their job is working directly with persons with homeless serving organizations. I worked with local leaders to make sure that our orientation would be robust and bring in lots of influence from folks I know at the at UGA, Fanning Institute, School of Social Work, folks like that. And then, got to say big kudos to the Continuum of Care because they worked really hard to push forward the directives that you all asked them to through the strategic plan. And so it was a pretty smooth handoff because of the extra work that they did, working on the work plan, scope of services, budget, all that stuff. That is crucial for us to move forward. So we had a board orientation in January. At that orientation, there was an election out of those 13 new board members to decide upon the executive committee. I was asked to and elected to serve as board chair. I would do that through the end of this year. And that through being a board chair, I also co-chair the Coordinated Entry Improvements Committee, and I chair the Executive Director Search Committee. Laura Patterson, who some of y'all may know, she is a minister at Princeton Methodist Church. She is the vice chair. She is also the chair of the Faith-Based Committee, which was a directive you all also put in that you wanted faith-based initiatives within the Homeless Coalition. Also, Cole Shackelford serves as board secretary and co-chair of the Coordinated Entry Improvements Committee. And then Cole Shackelford is in the audience with us tonight. He's a small business owner. Chris Greiner is the board treasurer, amazing board treasurer because he is the CFO of Clarke County School District and has lots of experience serving on boards. So we've got a jam-up executive committee. And we look at the role of the secretary a little bit different. Cole is an expert in technology, communications, things like that through the small business that he owns, more creative. And so Cole is more of our communications hub rather than just taking, not that secretaries aren't important, but taking notes and things like that, that is traditionally done in some meetings as the role of the secretary. Here's our board of directors. Dr. Catherine Rose Adams, who is in the audience with us tonight, serves on our board. She's served on a couple boards here in Athens. She is also the chair of Lived Experience Committee. Norman Baldwin serves on our board. Linda Ford serves on our board. Jason Leonard, Charlie Maddox, Ed Moore, Monica McGee, Tony Sanchez, and Jason Jacobs is listed here. Jason put in his resignation Wednesday of last week. So Jason no longer serves on our board of directors. This is an amazing board. Like, I've worked in nonprofits for 25 years, and my job of leading this organization at this time has been made much smoother, efficient, because of the work done by these board members. I kind of get paid to do it. They do not get paid to do it. They are doing this because y'all asked them to. So I just want to acknowledge all the work that these folks are doing, all the wisdom they're bringing to the room, and for no compensation financially, just because of their passion of working to better our community and to provide holistic and community love to those experiencing homelessness. I also have to say, too, big thanks to Lily and Alejandra at HCD because they have given lots of direction and coaching as well. So I have to say a big thanks to you guys as well. And Marcy. Marcy needs to be up there. And Marcy as well. Very helpful. In January, we had our Board of Directors orientation. We started our Coordinated Entry Improvements Committee. We started our Faith-Based Committee, Executive Director Search Committee. And so y'all have listed what we did here. You guys gave us orders. We went and did the work, starting January. Through January and February, I've been working with HCD to develop the scope of services, budget, insurance requirements. The scope of services budget and the budget was largely due by the amazing individuals who serve on the continuum of care. We've got John Morris and Ricky Willis back here who continue to work really closely at our part of the continuum of care and worked really hard to get us where we are at the Homeless Coalition. Chris and I have been working with Synovus Bank to get all that set up. Some of y'all might know, it's like starting a business. The hoops you have to jump through to get this thing started. It takes a lot of patience, I'll say that. Cole's revitalized our website for free, which is amazing. The executive committee meets monthly. We talk about a whole bunch of stuff. We have robust conversations. Out of the orientation, which was a robust conversation, which Ricky Willis came and spoke about his experience. It was amazing. Our board of director meetings, they're really, I don't know, there's a lot of talking and discussion, and they're really exciting to be in. We've developed our goals through June. We have a discussion of the impact of homeless serving organizations. Things that have come up was like the funding of Salvation Army. There were questions at the board like how come they got funding and other folks didn't. And the RFP process, like there are folks who serve on this board that are learning a lot about the process that they're reading about or watching you guys make the decisions on. And so we're offering the space for us to have discussions about this so that they can make informed decisions moving ahead about this organization. We've been asked by you all to review the RFPs for homelessness. We're doing that right now. We had 10 days to review 11 RFPs. That's a lot to ask people who are not getting paid to do it. But we're doing it because y'all asked us to. There's a small committee that's working on that, and I'm part of it. And I will tell you, every one of those RFPs have been amazing. It's going to be a hard decision, especially for the amount of money that's been allotted so far. Updates from the Continuum of Care Executive Committee. I get to sit in their meetings. They had a board meeting today. I get to share about what we're up to, and we have really good communication between all the nonprofits that serve homeless folks experiencing homelessness.
Again, Sally, back to that, just so I get these, the Continuum of Care Executive Committee is made up of homelessness service providers.
Correct. Yeah, John Morris is the chair.
It says executive committee. Is there a larger committee?
There's a board, and then there's an executive committee of the board. And then there's like a continuum of care, like all the organizations that are that give any sort of services to homeless individuals. There's monthly meetings for all of these things that are happening, so information is shared and that they can move forward in just making really good decisions about what we're doing with homeless services here in Athens. Yeah. And Lily attends those meetings as well.
And do we have good participation of all the providers?
I think we're growing. Now, I'm kind of new to this. If you would have asked me a year ago what I knew about homelessness in Athens, I would say almost close to nothing. And so I've learned a lot in the past 6 months, 7 months, 8 months for sure. What I have observed is that there is more participation by all the homeless service providers. In fact, I think on the board, almost all of them are represented. We just got the hospitals on. That's a big deal. We got the school system on. Not we, they. Continuum of Care got the school system on. So that's super cool that all those organizations are talking to each other. And I think that it'll make it even easier when we do roll out some sort of improved coordinated entry situation so that all of those will be bought into the process. In fact, we have Lily and some of the other service providers sit on the coordinated entry committee so that they will buy into the process. So it's not the Homeless Coalition saying, hey, do this. It's going to be like, hey, what do y'all want to do together? So our timeline, when I submitted this, we had not had our most recent Homeless Coalition board meeting. We had one last Wednesday. That we had a really robust conversation as well. But 4 things that we came up with are our goals from now through June 2024. Number 1 is to hire an executive director. We're interviewing 2 amazing candidates the week of March the 25th. The application is out. The application process is out. Number 2, guys, what are the expectations of the mayor and commission? This Homeless Coalition is really tapped into what are you guys expecting from us? And so what we've talked about is that'll be detailed in the contract. So that'll be the thing that's written in the contract that will follow. But with that, I want to say to every one of you, please reach out to me. Attend a board meeting. They're open to anybody. If you want to know what's going on with the Homeless Coalition, just ask us. We're incredibly grateful for the money and the support and the forethought and the forward thought to know that this is something that's going to be necessary for Athens to move forward on our homeless situation. So we just want to share information with you guys. Number 3 was understanding of the issue. And so we have moments of discussion with every board meeting. We had moments of discussion at our last board meeting where we talked about if you see someone on the street and you suspect they may be homeless, what are some ways that you can interact with that person with love? instead of fear. Something else that we're doing, a number of us are attending the Salvation Army open house tomorrow, which is a great way to learn about homeless services. I've been in touch with Bigger Vision. They're going to allow us to have a tour of Bigger Vision. We're going to go out and meet these places, actually go into them and see what's up. And finally, the fourth goal is our budget. We need to get that thing figured out. And what I mean by that is we have an idea of a budget, but you really don't know a budget. Budgets are fluid. Y'all know how it is. You really don't know what a budget is until you hire the executive director, until y'all land on a salary, until you actually know what office space is going to look like, internet, phone, all those things. Health insurance, as y'all just had an in-depth discussion about. You really don't know what the budget's going to look like until you get further down the road. So we look forward to doing that. What sort of questions do y'all have for me?
Commissioner Fisher?
Sally, thank you, first of all, for doing this presentation. Great job, and I appreciate the work that you all are doing. You sort of answered one of the questions that were you all getting questioned about how we was giving money to other nonprofits based on not doing the RFP.
Mm-hmm.
For me, and again, I'm just one commissioner. I'm never going to apologize. How we look at some nonprofits and what they provide to this community. The nonprofits in our community do a great job, and we want to support as many of them as we can. But we don't favor any one nonprofit. But me personally, I'm never going to apologize if we give money to a nonprofit that's doing good in our community. But thank you for that, and because we got letters from some of the nonprofit executive directors and CEOs sort of criticizing us for why y'all giving them money. Well, sometimes there are reasons why we do what we do. So, but again, for me personally, I'm never going to apologize for giving money to a nonprofit that's do good in this community. So.
I hear you. And that was a fruitful discussion that we had as a homeless coalition, because we started, our orientation was January the 6th, I think? And all that happened, January the 2nd? And so some of the emergency shelters were reaching out to us for support. We hadn't even had an orientation yet. So it was really helpful for me to learn from them what they're experiencing. But then I also reached out to you, and I reached out to John, and then some of our other board members reached out to some other commissioners to hear what y'all had to say about it too. So we went back and took that information to everybody. And we just had a discussion about it. No judgment was laid down. It was a discussion about it. And so I look forward to touring the Salvation Army. I've never been there before, but I look forward to seeing what they're up to tomorrow.
Commissioner Hull?
Thanks for this. I want to take seriously your question about how it's important to understand what our priorities are. And
Thank you.
At least in my mind, that strategic plan and its priorities that are mapped out in it is the thing to really see as our lodestar for the time being, at least. And so following through on that, sort of in the order of priorities that are there. But I think the other question that's going to sneak up on us quicker than we might want to admit is that at some point funding's going to have to come from somewhere other than ARPA.
Correct.
And so to some degree, I imagine this question might be a little cart before the horse because you'll need that executive director first. But I would be very interested, if you have any thoughts now, but certainly whenever this conversation circles back around, on funding strategies for a lot of those initiatives that go beyond just ACC Gov, so that we can clarify what ACC Gov's role would be in funding some of those strategies. I'm certainly hoping that our role will be more than zero after the ARPA money runs out. But it's also probably unreasonable for us to expect that it can be comparable to what we've been able to do with ARPA. And so how are we going to kind of leverage the incoming staff to get funding from elsewhere?
Right. Having run a nonprofit for 25 years, it's really exciting to have $1 million and so to spend in between now and the end of December 26th, but also very daunting at the same time. Like, we want to spend down the money for sure. We want to put it to good use. I will be able to work with the executive director that's hired to talk about how to diversify our funding. There's so many different ways that we can do it. We'll also work really closely with HCD to see. I would imagine that we would also have pieces of that funding that some of the other homeless service providers have as well. Apply for it. We'll see what happens. But the fact that it's a coalition will be a little different because it's not going to be direct service. And so we will look to examples in other cities that have pulled this off successfully to see how they drew down their funding. There's lots of different examples of how this can be done. My hope, and I can't speak for the executive director, but my hope as board chair is at least by the time that ARPA funding is gone, hopefully, by the time ARPA funding is gone, that the continuum of care piece will be run through the Homeless Coalition. That we will take some of that piece that HCD has been hanging on to and run that through us. That will create stability and validity for this organization moving forward. If you have so many other homeless service providers looking to them not only for relationship building and the coordinated entry piece and the lived experience piece and the faith-based piece, but also for funding as well and some sort of standards for all homeless serving organizations that receive that funding.
Commissioner Myers?
Yeah, I would say my priority as well is following through with that strategic plan and looking what's in there. I just thought of something else as well that goes along with that. But, as you know, we've had a couple of rough weeks here. And last week, right where you're speaking, a lot of us spoke to us about the effect of undocumented immigrants in the community, fears of safety, fears of what's going on in Athens, right? And again, I heard people go right from that fear right into homelessness in Athens. I realize that right now in the world we live in, that this is, I'm shifting now, there's the information out there, we do not have a newspaper that's covering things. We have bits and pieces. You gotta look here, look there. And so one of the things I think would be helpful for me as a community leader is for the Homeless Coalition and the executive director to not only put together reports, but to release press releases to our various places so that we can get out the accurate information about what we're doing in Athens to address homelessness. And we might have it some places in documents here and there, but I think it's become such an issue. I expect to hear it talked about as in this election season, and to be more than just a repository, but proactively reaching out with that information about what's going on. So that's just one thought, because it came up as a topic a lot.
That's what I was thinking as well, and that's why I was really excited that Cole Shackelford took on his seat on the board, because he's a communications expert.
Yeah.
So yes, we were also thinking strategically too, that coordinated entry piece, gathering that data correctly and efficiently with a whole picture of what's going around, and then communicating it out to the public with people who literally do that every day, telling us how to do that, then that is an asset. Yes, I agree with you 110%.
Any other thoughts? Sally, the only thing nobody? The only thing I wanted to add, and really it's a question to Manager Williams. I think a minute ago I sent you an email. I would like to see what the past continuum of care applications were, maybe 2 years of those.
Okay. So just to be clear, you'd like to see all the applications we received?
No.
The ones that we submitted to the
The
government?
ones that we submitted.
No problem.
I would like to see what they look like.
And I'll give you I think the agenda items with that too.
Okay,
That'll be
okay.
helpful. Explain.
Yeah, because I think that was one confusing part for most of us, the Homeless Coalition, continuum of care. And as far as I could tell, it looked like HCD was actually the continuum of care.
That's correct. So when I refer to the continuum of care, it's a group of folks, but HCD runs that piece so that there can be federal grant funding running through HCD.
They facilitate it.
Yes.
So,
So everybody, Lily from HCD is going to give us an explanation.
So myself and Marcy Irwin, along with the COC governing board, prepare the continuum of care application. While HCD is the collaborative applicant, the COC governing board is the COC lead applicant. So that's a requirement by HUD to have both a collaborative applicant and a lead applicant. So we, because of our capacity, and that's just how it's been done, but as Sally was saying earlier, by 2026.
Maybe.
Yeah, maybe.
Yep.
Okay. And that's, oh, I'm sorry, Commissioner Hull.
Well, I'll be well out of this seat by 2026, but that plan, which I think has been part of the plan all along, sounds fantastic, and I hope that this body on this side of the rail will continue to retain the staff that we have in HCD that's currently doing a lot of that work and utilize them to do even more than what they're currently bogged down in doing, so the continuum of care can take that on, and hopefully HCD can evolve to be even better in what it's able to do. So
They're asked to do a lot.
food for thought for my colleagues in the future, that those jobs can do a lot more than what they're currently doing. So.
Okay. Anybody else? Sally, thank you.
Yeah, thank you for your time. I appreciate it.
Commissioner Fisher, you got a look on your face.
I say motion to adjourn.
Okay. All right, let's do that.
Motion to adjourn.
All in favor? Tiffany, all in favor? Aye.
That's why I had a look.
Okay.